Hey, my name is Adriana and I'm a student physical therapist here at Campbell University. Today we're going to talk and then we're going to perform central and unilateral posterior-anterior glides to the lumbar spine without physiologic motion. Now we're going to talk about some research behind these glides and if they're effective or not effective. So according to the Wise book, central and unilateral glides are indicated for restrictions in segmental mobility in the lumbar spine in all directions. Central glides primarily assist with sagittal plane motion, so forward bending and backward bending, while unilateral glides enhance rotation and side bending since it's more unilateral. According to a research article done by Shah and Cage, they looked at the effects of a prone press-up versus a posterior-anterior mobilization of the lumbar spine in those who had non-specific low back pain. The results of that study showed that posterior-anterior mobilizations were superior to prone press-ups in improving lumbar extension in those with back pain and overall improving their function and quality. A randomized controlled trial done by Perry and Green looked at seeing if there was any sympathetic nervous system effects from unilateral posterior-anterior mobilizations to the lumbar spine. The findings of their study suggested that there are neurophysiologic and anatomical interrelationships in the lumbar region with posterior-anterior mobilizations, which can be modulated through mobilizations to the spine. I just finished up talking to you guys about the research, so now I'm going to show you a step-by-step of how to perform a posterior-anterior mobilization, a central mobilization first and then a unilateral mobilization. So the first thing you want to do is, as always, is ask your patient if it's okay for you to work with them. Once you've gotten that out of the way, then you want your patient to lay prone, and once you have your patient laying prone, then you're going to start getting your hand positioning ready. So for the central mobilization, you want to use the pisiform contact. So you find your pisiform, and then you're going to place it on the spinous process on the lumbar spine that is giving the patient pain or difficulty with their motion. And once you find that spinous process, you're going to put your pisiform on it. You're going to keep your arms extended, your elbows extended, and then what you're going to do is you're just going to push down on their back. There are 4 different grades, according to Maitland, of mobilizations. Grade 1 and 2 are for pain relief, and then grades 3 and 4 are for stiffness. And now for a unilateral glide, instead of having your hands or your pisiform on the spinous process, you're going to go and you're going to find the transverse process of that same segment. So for this one, you're going to have a thumb over thumb contact versus a pisiform contact, just because it's more comfortable for the patient. So once you find that segment, you're going to go find that transverse process, put thumb over thumb, and the same thing is arms extended, elbows extended, and you're going to push down. And the amount of push you give varies on what grade of mobilization you're trying to achieve for your patient. So I just showed you guys how to perform the posterior-anterior mobilizations centrally and unilaterally, step-by-step on a patient. So now what I'm going to do is I'm going to show you guys how you would kind of talk to your patient about performing this technique and then performing it on your patient. So, hey Cam,
hey.
How are you today?
Good.
So as you know, we just finished your evaluation and we found that you have low back pain. And with your low back pain, your pain kind of increases when you go into extension, or you have a lot of difficulty going into extension.
Yeah.
So I wanted to try a manual therapy technique on you that I think will be beneficial in helping decrease your pain and kind of improving your range of motion so that you can extend your back and it won't cause you as much pain. Okay. Does that sound okay? All right. Well, first thing I need you to do is lay on your back for me, or lay on your stomach for me.
Okay.
And is it okay if I lift your shirt up?
Sure.
All right. All right, so you should just feel a little bit of pressure. If you feel any pain or discomfort, please let me know, okay?
Okay.
Is this the spot that hurts?
It's a little tender there.
Okay.
Yeah, it's a little tender. That's better.
how you would do it.